Hi, my name is TJ. We're going to do IV Minibag medication administration. It's for adult health 1, that's for single class section 7. The doctor, I'm going to check the MAR for this patient. The doctor has ordered 1 gram of Rocefin. It's available in a vial, 500 milligrams per milliliter. So we're going to give 2 ml into the Minibag. Rocefin is indicated for this patient has a respiratory tract infection. First, I would check the MAR for the patient's history of allergies, if they have any allergies to penicillin or milk protein or milk products, dairy products. Check pertinent labs for the respiratory tract infection. This medication will have to be given over 30 minutes. So to calculate it all, the drip rate is going to be 17 drops per minute. So I'm going to wash my hands and assemble my meds. Got my Minibag, my syringe, my drug, and I will add my drug to the Minibag. I'm going to turn off Rocefin, date, clarity, expired. Clean my now we go into Sharps container and medication. Label it. Put on here what drug it is, the amount. Put my initials, the date, time, and then the patient's name. I'm going to get my tubing. There. Find my tubing. Now I'm going to drop 6 ml of normal saline flush to ensure patency is IV line. Clean off saline. And at this time, I would gather all my things and walk into the room. I'm also going to label the tubing, name, date, initial, time, and what drug it is. So now I'd gather all my stuff and I walk into the room. I'd ID the patient on their wristband. I'd check for allergies. And then, explain to them what drug we're going to be giving, the Rocefin, and then I set up everything. Wash my hands, don gloves. I look at the IV site, make sure there's no colitis, inflammation, redness, swelling, edema, anything like that. Ask the patient if they're having any pain with that IV. As long as everything's okay, continue. Off to flush. Aspirate. Make sure you've got blood return after unimplanting the tube. Aspirate. Blood. Stop method. Ask the patient if they're having any pain. Pain and swelling. That's patent. Now I'm going to clean the port again and attach my IV tubing. Still clamp. Set the drip rate to 17 drops per minute. Okay. Wait a minute. I would take my gloves off and make sure the patient is not having any pain swelling again. I would intermittently check on the patient because this is going to be given over 30 minutes. I would come in about every 10 minutes and check on the patient, make sure they're not having any adverse reactions, anaphylaxis, fevers, anything like that. Once the IV is finished, I would come back in, wash my hands. I'll just put some gloves on. I'm going to clamp off. And then I'm going to flush the IV site again. If this were a PICC line or a port, I would use heparin. Application after having pain, swelling, edema, that. And then I would dispose of my sharps. Then I would exit the room and go to the MAR and document the time that the medication was given, the duration of time, the patient's reaction to it, what drug it was, where the IV site was, and where the drug was administered, and the volume the patient